Thank you, Nathan. Okay, we'll start then, if everyone's ready. Prynawn da pawb, croeso I gyfarfod gyffredinol blynyddol Bwrdd Iechyd Prifysgol Caerdydd a Fro. Good afternoon, everybody, and welcome to the annual general meeting of Cardiff and Vale University Health Board. My name is Charles Janczewski, more commonly known as Jan, and I'm chair of the Cardiff and Vale University Health Board. I would normally introduce colleagues, but as we've got 22 members of our board with us today, I will not introduce them individually, but the details are available to you on our annual report and on the Health Board's website. However, there have been a couple of changes within our board team since last we met. Firstly, a warm welcome to Matt Phillips, who joins the Health Board as the new Director of Corporate Governance. Do you want to give it a wave, Matt? Thanks very much. And a fond farewell, sadly, to Michael Imperato, who was an independent member of the board representing legal, who undertook a period as interim vice chair as well during his term of office. And I'd like to express my sincere gratitude to Michael on behalf of my fellow board colleagues for his service, and obviously to wish him well and every future success. Thank you for joining us today, everyone, and for the questions that some of you were able to submit prior to the board meeting, or the AGM rather. It's really very nice to have so many of you join us as we look back over the past 12 months, which have been quite exceptional. I'm also advised that the session is being live streamed for our viewing public to watch, so hopefully this will be trouble-free. However, if we do run into any issues, you're very welcome to replay the recording at any time, which will be made available shortly following today's meetings. Before I go into the formal agenda today, I'd like you to be a little bit patient and bear with me. I want to share some of my reflections with you on the year 22-23. And what a year it's been. The challenges have been immense as we've been worked very hard to restore as much normality to our services as possible, but we still have the impact of the COVID pandemic still very much with us, so it's been difficult. Our staff across the Health Board have been magnificent in their endeavours to rise to these challenges, and have continued to provide high quality and compassionate care to our patients throughout. They're stunning, absolutely stunning. There have been so many occasions during the year that I can recall where my colleagues, our partners and stakeholders, our patients and their loved ones have inspired me, and I mean truly inspired. They've been brilliant. We've got a great team here at Cardiff and Vale. I know that you suspect I'm a little bit biased, but it happens to be true. I think it's been a challenging year for everyone, but it's probably appropriate for me to acknowledge the sad passing during this period of our late and long-serving monarch, Queen Elizabeth II. She was an ardent supporter of the NHS, our colleagues, and hundreds of charities and organisations that are vital as a part of our care system. In November 1971, Queen Elizabeth II formally opened the University Hospital of Wales, and during that time she met with staff and patients, and I'm sure those that were present remember it with great affection. More recently, Her late Majesty presented the NHS with the George Cross, recognising the contributions of staff over its 70-year history. Testament indeed to Her Majesty's unwavering support for the NHS over the course of her reign. 22-23 was a year where the National Health Service continued to feel the ongoing and adverse impacts of the coronavirus pandemic, as I mentioned earlier. The impact was notable in respect of patient waiting times across our tertiary, primary and secondary care services. Cancer treatments were particularly difficult, and this remains a challenge felt across the UK even now. The transmission of respiratory viruses such as flu and COVID-19 continues to circulate amongst our communities, which is widely known to cause a seasonal spike in hospital admissions and, very sadly, some deaths, particularly among older and more vulnerable people. However, the resilience and commitment of our vaccination teams has been truly inspirational. This has resulted in a successful autumn booster campaign and a positive uptake in immunisation of our local population who visited our satellite sites such as Woodland House here in Cardiff and the Barry Mass Vaccination Centre in the Vale of Glamorgan. My thanks to each and every one of you involved in the vaccination programme for protecting our colleagues and keeping our communities safe and well. The year was also remarkable in terms of collaboration between our partners and health colleagues. particularly the field of research and innovation, which saw the launch of many flagship services and initiatives here in Wales, including the following as some examples. We saw the first patients undergoing robotic-assisted surgery using state-of-the-art surgical robots. This type of surgery is now helping to treat colorectal and gynecological cancer patients in Wales as part of the new National Robotic Assisted Surgery Programme. Cardiff and Vale Health Board was instrumental in pioneering the UK's first syndrome without a name clinic. We commonly call it the SWAN clinic, which offered hope for patients by shortening the identification period of undiagnosed rare diseases across Wales. It's had a significant impact on our patients. The nature of services for patients with rare diseases is changing rapidly. There are major advances in testing, particularly genetic testing. It is with enormous gratitude that we have been fortunate to secure funding for a 2-year pilot programme from Welsh Government and the Welsh Health Specialist Service Committee. Also during the year, we launched the pathway of low anterior resection syndrome relief after surgery in partnership with CEDA and the University of Leeds. This has been a significant investment to explore potential treatments for patients living with low anterior resection syndrome, which is a common condition affecting up to 3 in 5 patients who've had part of the bowel removed due to rectal cancer. And I'd like to give a special mention here to a colleague, Julie Cornish, one of our consultant colorectal surgeons who is leading the study on this exceptional programme. Thank you, Julie, and well done to you and your team. Elsewhere, more than 300 patients with suspected sepsis have been successfully enrolled in trials for the timely identification of sepsis and optimal use of antibiotics in the emergency department at the University Hospital of Wales. The trials are funded by the National Institute for Health and Care Research and led by the University of Liverpool. Through point-of-care testing, which provides results in as little as 20 minutes, clinicians are able to better risk stratify patients with suspected sepsis and help guide decision-making and avoid unnecessary use of antibiotics. Earlier this year, Cardiff and Vale Health Board launched a school in-reach service for emotional well-being and mental health. The service enhances the skills and confidence of school staff, providing timely access to specialist advice, liaison and consultation for educational professionals. In a short period, the service has made a positive stride in improving emotional health and well-being of staff and younger people in schools. I'm really grateful to my colleagues working in the community and the education setting to ensure the future generations are well supported. Thank you all very much. I suppose I can't reflect on the year without talking about finances a little bit. We're all aware that there's been widespread national industrial action by public sector workers in a dispute over pay and working conditions, and more recently, the precarious financial climate of public sector services. Sadly, Cardiff Vale University Health Board is no exception. While it's disappointing to see that the Health Board continues to operate in slightly escalated Welsh Government review status known as enhanced monitoring, I believe this to be a reasonable assessment of our current financial and planning position, and I'm confident also that we can continue to progress our way forward and remove that monitoring status in due course. The financial challenges continue to affect us all, both organisationally and as individuals. The cost of living crisis impacts many people in the most deprived communities across Cardiff, the Vale of Glamorgan and indeed Wales. And of course, this can have an adverse effect on their health and as well as their ability to access health services. However, in the meantime, I'm amazed at the efforts of our team to drive forward with ministerial priorities and other essential services. It's been quite remarkable to see the energy and effort and success that they've achieved, ensuring that we still deliver the best possible high quality care for our diverse communities across Cardiff and the Vale of Glamorgan. Your work has been exemplary, everyone. Thank you all very much indeed for that. I think it's also important to recognise that the NHS doesn't work in isolation. We work very closely with our partners, including our local authorities, universities, third sector and Welsh Government, to name but a few. Alongside our dedicated and committed staff, I would like to thank them all for their contribution and the support they give to deliver health services across Cardiff and the Vale of Glamorgan. There have been a few gloomy observations I've made, unfortunately, over the last year, but I'd like to finish my reflections on a more positive note and by looking back perhaps and acknowledging the outstanding award-winning achievements of our staff and stakeholders throughout the year. No particular order, but first up, Cardiff and Vale Health Board Rehabilitation Model Team won excellence in rehabilitation at the Advancing Healthcare Awards for their approach to recovery, addressing health inequalities by optimising health and supporting self-management. Orla Adams, our dietetic lead for maternal weight management, has won the award for improving public health outcomes. Well done, Orla. Judith Jenkins, who has since retired from her role as head of nutrition and dietetic service, was awarded Allied Health Professional of the Year. Fantastic. Other wins include clinicians on B1, a cardiac ward at the University Hospital of Wales, which became the first to receive a new award for positive outcomes for both colleagues and patients. In primary care, the Cardiff South West cluster, which works together to improve health and well-being for communities in Ely, Caira, Canton, Riverside and Pontcanna, was presented with the Equality and Inclusion Award at the Vaccination Saves Lives ceremony in Wrexham. The NHS Wales University Eye Care Centre, who were honoured for their innovative collaboration at the HSJ Digital Awards in 2023 in Manchester, for digital literacy, education and upskilling category for their fantastic collaborative work in helping to reduce sight loss. We were very well represented this year at the Royal College of Nursing Awards, with several individuals recognised. And perhaps I give a cheeky special mention to the lead nurse practitioner in hepatology, Tara Rees, who scooped an award for advanced and specialist nursing, but also the highly coveted Nurse of the Year award. Fantastic achievement, Tara, and thoroughly deserved. I'd also like to congratulate interim specialist midwife Cara Marizzi for her win of the Children and Maternity Midwifery Award, and early years bladder and bowel assistant practitioner Heather Fleming for the Healthcare Support Worker Award. Congratulations to all of you, and I guess that's a short list of some of the achievements that have been witnessed over the last 12 months. Thank you for being patient enough to listen to my reflections over the year, and I'd now like to move us into the formal part of today's agenda, if that's okay. And we're going to start with apologies for the meeting. Nathan. Are you there, Nathan?
Apologies, Chair. Yes, we've had apologies from Sarah Mosley, independent member for the third sector, David Thomas, Director of Digital and Health Intelligence, Mariel Jenny, the Executive Medical Director, and Fiona Jenkins, the Executive Director of Therapies and Health Science. However, I do believe I can see Fiona here, so
yeah, I thought it was.
Apologies.
Okay, nice to see you, Fiona. Okay, if that's all, I'm going to move on to the minutes of the last AGM. I want to run through them for accuracy with you first, if that's okay. So I'll just run through the pages. Page 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. Are colleagues happy that they're a true and accurate record of the last AGM? Any matters arising that aren't on the agenda today? Thank you very much. Okay, next item on the agenda is the annual report for 22-23, and importantly, the quality statement of intent. Our Chief Executive Officer, Suzanne Rankin, is going to lead us in this session. Over to you, Suzanne.
Diolch yn fawr, Jan, and Prynawn da to everybody on the call joining us for our annual general meeting. Jan, you've done an incredible job of setting the scene for the discussion this afternoon, and just reminding us of the scale of what has been achieved across the Health Board over the last 12 months, financial year 22-23. But also you pointed out some of the important factors that influence on us heavily, whether that be outside of the organisation, such as the cost of living crisis, the inflationary pressures upon us, but also factors within the organisation that particularly and uniquely affect us. So, you know, the impacts of the industrial action that we've seen many colleagues taking over the last 12 months, and of course the ongoing impacts of responding to and recovering from the COVID pandemic. And whilst we would sort of reflect that the last 12 months have indeed been a year without the pandemic, you know, I think you said, Jan, and it's true to say that we still see patients with COVID. We still have to manage that operationally, and it continues to place an additional demands on our team. And of course, you know, whilst for many number of years now we've been focused on COVID in particular, there are a range of pathogens that present a threat to our community, our workforce and our population. And as we head into the winter, we are fully embarking upon our winter respiratory virus programme and response. So my job this afternoon is to briefly take colleagues and members of the public through what is a very detailed report, the annual report. And so I'm not going to make even scratch the surface in terms of getting into the detail. So it really is a snapshot, and the document is available publicly for those who are interested in the detail. I'll be joined on the call by my colleagues Catherine and Paul, who can give more detail on the financial position and the operational response to that in due course as we follow through the meeting. And then I know we're coming to questions, Jan, at the end of the meeting. So again, thank you to colleagues who've given us that opportunity to respond. Next slide, please. So I think, you know, I've been here now over 12 months, joining the organisation in February 22. And it's been an absolute privilege and a joy to lead the team and work with so many fantastic colleagues over that last 18 months, 19 months or so. Every day I am impressed and humbled by my immediate team and colleagues, but also those that I meet as I move around the organisation. And Jan has covered one or two of some of the incredible high points, but also, you know, just how fabulously the team responds to so many different varied challenges is just truly, truly impressive. What I would do is I would try and cover off some areas relating to finance and performance, but accountability as well. And then really importantly, the quality statement of intent. As Jan has said, we are in a position of finding ourselves unable to present a balanced financial position, and we remain in enhanced monitoring for planning and finance as a result. But equally, I'm confident that the team have done incredible work to develop a plan which is credible, which is stretching and ambitious, and which takes very seriously our responsibilities in contributing to the position right across Wales. We will also talk later in the meeting and launch our Refresh Shaping Our Future Wellbeing strategy. Again, Abby and the team have led an incredible piece of work there to co-produce our Refresh strategy with our colleagues, with our stakeholders and with our residents and population. And I hope you will find the result is a really good synthesis of the intent of the original strategy. It's not a big change, but hopefully brings clarification to the priorities and starts to help us galvanise around a set of strategic objectives that will absolutely deliver on our strategic intent. And of course, I'd like to thank our partners who, you know, have contributed to that work, but actually every day provide great support to our teams and our population. The annual report really is a collection of reports and documents that detail with data our approach to delivery, our approach and achievement in relation to performance. And of course, all of this information is important to be increasingly transparent and available to the public and to members of the team. And so please do endeavour to take a look at that information, and do let me know if you think there is something I can improve upon in terms of the presentation. This infographic you have on the screen is a bit of just a snapshot of what we've delivered over the last 12 months. And I suppose it really aims to give a scale of what goes on in our organisation. It is truly extraordinary. So we serve a population of just over 500,000 people. But you can see there some of the statistics on the bottom of the screen. Vast numbers of patients have contact with our services every day, whether that be the utilisation of our emergency care pathway, outpatients, the birth of newborn babies, or indeed planned hospital procedures. And you can see there that of the 6,337,000 people who responded to our patient experience surveys, 95% of those said they felt safe in the health board's care, and that is a real testament to our teams and their contribution and the commitment and professionalisation of our colleagues. So a big thank you to them. As we move forward, I want to really work hard with all of you and those beyond and partners to ensure that we can really deliver on the strategy to address many of the challenges we've got and to deliver the vision, which I'll just speak to now. Working together, we will help improve lives so that by 2035 people are healthier and unfair differences in health outcomes are reduced. And I'm firmly committed and confident that by working together we can achieve that vision. Next slide, please. So this is a snapshot that gives you a sense of our financial position for 2023. As you can see there, we're actually allocated a very large amount of public money, £1.86 billion, and that is an enormous amount of money, and we do take our responsibilities to safeguard that money very seriously and ensure that it is spent on delivering the very best health and care for the population we serve, but also in the delivery of tertiary and specialist services to the people of Cardiff and Vale of Glamorgan, but also those of South East Wales, South Wales and beyond, and in one or two circumstances, indeed, the rest of the United Kingdom. I think I've touched already on our position in terms of our integrated medium-term plan. So last year and going forward, we will be delivering annual plans that describe our approach to delivering of the range of priorities that we have, the ministerial priorities and so on, and how we're going to organise ourselves to deliver on those. We are a very large and complicated organisation with over 16,000 members of the team, and I need to work with colleagues very closely to ensure that we're able to identify opportunities to be more efficient and effective, to deliver better care, to achieve a sustainable financial position into the future. And I believe we are taking the right governance steps and the right collective leadership arrangements are in place to ensure that we can continue to improve on that position and get the very best value of money for our taxpayers, but also for our populations and patients. And Catherine will take you through more of the financial detail following completion of my presentation. Next slide, please. There we go. So this is a slide depicting some snapshot elements of our performance, covering primary care, mental health, urgent emergency care, and planned care. So I'm just going to step through them, but I suppose what this demonstrates is some absolutely fabulous achievements in terms of the commitment to recover the position following the sort of coming out of the pandemic. But really, two elements, I would say, a really sustained attempt, intention and delivery in terms of improving generally. So, you know, recovering the position, reintroducing what we might call business as usual, getting all our services up and running to the same level as we've been operating them before the pandemic. And then some really key and targeted areas for improvement where we felt as a team, where our patients and our teams were telling us they were badly needed. So in those areas of the urgent emergency care pathway, ambulance handovers, for example, planned care, cancer care, some really significant and targeted improvements. So an overall approach to improvement with a support and specific and intense activity in a number of areas. And I must thank our Chief Operating Officer, Paul Bostock, and his team, who is very well supported by other members of the executive team to deliver on some of these key ambitions. They've been really quite incredible. So just to pick a couple out, you can see there that over the last year we've increased our dental activity by 70%, and that has been a particular area of concern for our population out in primary care. So that's really fabulous to see. A reduction in emergency admissions for the over 65s. That's a really good example of pathway work where clinicians and multidisciplinary teams working outside and inside of the hospitals across that pathway of care are working together alongside their local authority and social care colleagues, really important members of that team. I think the reduction in lost ambulance hours is absolutely something we should all be very proud of, because although it feels very focused in the emergency department, it is a whole organisation activity, and colleagues from right across the organisation, primary care, mental health, inside the hospital and in the emergency department, and into the hospital in the ward and clinical areas, and then back out again into the community. Actually, you cannot achieve that kind of improvement in the ambulance service response by this organisation without everybody pulling together. And it's fabulous to see that our organisation is leading the way in Wales in terms of this area of care, and it's so very important. This is about giving assurance to our population and citizens that should they call an ambulance, they will be responded to in a timely way. So that is great to see. Same day emergency care, similarly, a really important part of how we respond to those who find themselves acutely unwell or with an acute injury. Our ambition would be to get to 90% of our patients who present in that pathway being seen through a same day emergency care unit. And you can see that for the surgical unit, we are now at 70%. So that's a huge expansion of the service offering there. And we have now established the medical same day emergency care unit. So we're well on our way to achieving that ambition. Again, the scale of what goes on out in our community is depicted there. 190,000 visits by district nurses, just quite an extraordinary kind of level of support to our community in their own homes very often. And I would just like to say, the members of our nursing team that work out in the community don't often get much acknowledgement, but they do amazing work, often working autonomously and independently, not in the support of a wider team in an institution like the University Hospital of Wales. So, big thank you and well done to the team. And then in the areas of planned care, real challenges in terms of delivering cancer care and the diagnostic pathways, but we're well on our way. I think we got to 61.5% achievement of meeting the 65% target for the single cancer pathway last year. And we've seen a 50% reduction in waits for endoscopy and therapies, which is really important. And then, not at all last or least is the work we're doing to improve mental health care with the implementation of Press 2 in 111, which is direct access for our mental health patients, and just another example there of improvement in eating disorder response. So huge amount of work going on to improve the overall performance of the organisation, and performance is important because actually this is how patients experience our care and access our care. Next slide, please. So I just wanted to share one or two sort of areas of key focus for the organisation where we've really applied ourselves or taken a slightly different approach, or recognised that actually it's a really important part of our offer that actually sets the scene for how we take care of the wider population. So here you can see a couple of important areas of focus in terms of setting children and young people up for a happy, healthy and long life. So vaccination is a really important part of taking care of our youngsters. You can see there that we've got 81.8% of children up to date with their scheduled vaccinations by 4 years old. And that's a really important part of giving them resilience as they start to begin their school journey, and also to protect the population from the circulation of diseases. So really important, and good to see that level of achievement. And then healthy weight. I mean, we'd probably talk the rest of the meeting, but we won't, about the implications of diet and weight on wider health and well-being and on services. But really important that we focus on supporting families and young children to achieve healthy weight. And there's a good figure there, 74.6%. So these are areas of focus which contribute to the wider population health as well as individual health and well-being. Huge amount of work, I think I've already touched on, in relation to the implementation of the Urgent Emergency Care Plan, which is aligned to the Welsh National 6 Goals Plan. Really good to see that wide multidisciplinary teamwork around that pathway, and the partnership working is really strong throughout as well. I think you've pointed out, Jan, some of the celebrations that we've been able to have with colleagues, but as you said, recognition for our work to deliver our model of rehabilitation. So that was great to see, and congratulations to everybody involved. Really focusing on that care closer to home element, which is really about ensuring that out in the communities there are wellbeing hubs and urgent primary care centres and other places where members of their population can access healthcare and support or advice around health and well-being. And I think we've also touched on the need for collaboration in times such as challenging as we have experienced and we're going to experience. Collaboration is going to be really, really important. So I've been really particularly pleased to see the strengthening of our regional working with our colleagues in other health boards, Nairn Bevan and Cwmtaf Magelig, who really, I think we've come together as a South East Wales NHS Wales region, and we are really looking at what are those opportunities for us to work collaboratively and deliver different for our population. So we've got lots of plans in train. We've developed a shared business case for cataract expansion. That's well underway. And there's some really good plans emerging around improving access to diagnostics and orthopaedics planned surgery for population that we serve across South East Wales. And one of the things that I'm particularly enjoying being involved with is the Genomics Partnership for Wales. Really impressed to see how global leading actually Wales is in terms of this arena of work. We've got new facilities coming, which I think we've just taken receipt of, we'll be able to move into, which will create the opportunity to bring all the partners together and really boost the opportunity that presents to ensure that the population of Wales get access to innovative and novel methods of diagnosis. You referred to the Swan Clinic, Jan. It's exactly in that arena. It's so fabulous to see, and will make a big difference to how we deliver healthcare into the future, and is really an important part of our sustainability plan. And then the launch of the Regional Vascular Service, which I know many years in the development, huge amounts of collaboration and partnership working, is really now bedding in as a sustainable model for the delivery of that service. Next slide, please. Of course, there are challenges, and I think possibly we've touched on one or two of these in the discussion thus far. But key challenges from my point of view, and these will be no surprise to anybody. First and foremost, the quality and position of our estate. The University Hospital of Wales is a particular concern, but to be honest, all of our estate, there are challenges, and we have a significant backlog in terms of backlog maintenance, and being able to maintain the estate is a real challenge. Just one point of assurance, we've recently conducted the appropriate audits in relation to RAC, and we're confident we don't have a particular problem with aerated concrete, so that is good to see. I think delivering and balancing our huge range of roles that we have to service our local population through our primary and community services, but also to deliver secondary care to our local population at the same time as delivering this tertiary and specialist care to the wider population, and balancing those things is a challenge, and that's something we need to keep considering and working on and discussing and taking feedback on. How well are we doing that, and are we creating the right enough space, capacity and capability in the organisation to address inequalities that might be felt in those areas of service delivery. I think there's a real piece of work for us to continue to do, and thank you to Fiona and her team leading on the population health outcomes work. But we've got a fast growing population in Cardiff. We've got great variation in levels of deprivation and levels of access to service. We've got a rural population out in the Vale that gives us a different set of challenges, and distance is an issue and accessibility is an issue for different reasons. So we've got a huge amount of need in our community that is quite variable in shape and is ever a challenge to respond to, so that every individual can feel their needs are being met. So we've got work to do there. Workforce, I think, you know, we will just recognise, and I hope you'll see in the strategy how important that is in terms of sustaining for the future. I think we've covered the money, and we will talk about that more later. And then we've talked about the external risk factors which sustain into next year, such as potential industrial action by our medical colleagues. Next slide, please. So what does the future hold then? So we've got 4 strategic programmes driving our strategy realisation, and we'll come to those as we present the strategy. I think I've already pointed out the need to maintain and strengthen our partnership working, and that will be how we address our urgent challenges. We've got work to do around the infrastructure of the organisation, and I've already sort of commented on the estates challenge, but actually when you ask our colleagues what they think the biggest infrastructure challenge is, they tell us they believe it's digitisation of the organisation and the need to build a wide capability that is reliable and supports clinical decision making wherever they happen to be working in the organisation. So if we move to the next slide, just important to note that, you know, we are absolutely on that digital journey. We very much are committed to, and have committed to within the new strategy, the refresh strategy, to deliver what might be called smart hospitals of the future, which really just speaks to kind of, you know, digital connectedness, the ability to share information and to use that information to inform decision making and plans and activities. So I think whilst the financial context around us makes some of these priorities difficult, I think we are very much in a place of wanting to take every opportunity that presents. We have had support from Welsh Government, which is really good to see. There's more to do in that arena, but just to reassure that we are very firmly in the same place as many of our colleagues in terms of how important the digital journey is. Next slide, please. So before I move on to the quality statement, really just a huge thank you. Thank you to my board colleagues, my executive colleagues, and of course the wider team, who are just really quite extraordinary every day and make a big difference actually to me personally and to so many of their team colleagues and their patients, their families, and those who rely on us for their care and treatment. You know, really just so proud of all that you do every day. So diolch. Moving on then to the quality statement of intent. This is a really important articulation of a commitment I hope the board will endorse with me. I think there's something about recognising the challenges that we've had in relation to the delivery of quality of care for our patients in a very robust and reliable way. And I know that everybody feels that we want to give the very best, high quality, safe, effective, timely and efficient care. But actually, as a big organisation of our scale, we need to organise ourselves in such a way as that becomes inevitable. So we are doing work. Learning has been secured from recent HIW inspections and from wider reports such as the Ockenden Review in England. So we're constantly looking for the opportunity to learn and understand and then move into a position of activity around this. And importantly, we've committed to a number of quality principles, and they will be enshrined and developed within our Shaping Our Future Through Quality Excellence programme, which will bring about a coherent approach to the delivery of quality through a quality management scheme process focused on these principles articulated here on the screen. And so there is an important piece of work for us to do across the organisation engaging in this, but also coming together around the key enablers of this important piece of work. You know, I've spoken about digital and the importance of data and information, ensuring that we build skills in our organisation and team so that they can actually harness the power of that information and interpret it, supporting innovation, research and development and improvement methodology, looking for transformational opportunities as well as the more incremental opportunity to steadily improve, empowering and creating a safe, psychologically safe culture for our team, looking for behavioural indicators of our values that feel authentic, and creating an environment of compassion and kindness. Those are the real important elements that will help us achieve the quality statement. Clearly, the quality statement, making it in this public way, creates an appropriate accountability and makes that commitment. And I think we really welcome that opportunity to make this commitment. So I absolutely would endorse the quality statement of intent to the board. And I will complete my discussion there and come back to the chair. Thank you, Jan.
Thank you, Suzanne, for a very concise summary of a massive amount of work that's been undertaken in the last 12 months, and managing to condense the annual report into such an effective format, I hope will help our audience today, certainly help me. It's clear you've got a huge passion for your role, Suzanne, as Chief Executive Officer, which delights me as a chair, of course, because it means our people are getting looked after. And hopefully colleagues will fully endorse the quality statement of intent. Okay, I don't propose to take any questions because we're all familiar with the annual report, but Suzanne, really appreciate your presentation today. I'm going to move us on to the financial accounts, item 3 on the agenda, the financial accounts for 22-23, and Catherine Phillips is going to present us with the data here. Catherine.
Thank you, Chair. So first of all, apologies, this is the annual accounts for 22-23, not 21-22 as it said on the preceding slide. So if we dive into the money, please, can I have the next slide, please? So we have 2 financial duties as a health board that we need to apply. One is that we do not exceed the amount of funding allocated or we can generate by Welsh Government or for our population in a 3-year period. And also we have a duty to submit a plan that is approvable by Welsh ministers on a 3-year basis. Next slide, please. As you can see, and has already been discussed today, we were not in a position to do either of those things last year. So we're in a position where we submitted a plan to deliver a deficit of £26.9 million. And that was due to the fact that as we came out of COVID and the cost of living and increased prices because of energy, the impact of economic and also wider worldwide pressures, including the Ukraine war, have driven some of our assumptions versus our funding in the wrong direction. So we expected and delivered a £26.9 million deficit. Next slide, please. The operational position as the deficit is there, as you can see, we also had a small surplus in the previous of the 2 years, which means when you add the 3 years together, we had a combined deficit of £29.5 million, and therefore we didn't achieve the duty. Thank you. Next slide. We also have capital resource limits. We received and gained funding from Welsh Government of £55.5 million last year, and we spent that money all bar £100,000, and you can see that that was a similar picture to the 3 years previous. So we did meet the duty to spend and maintain our capital expenditure within the resource limit given to us by Welsh Government. Thank you. For those of you like me who like the numbers, you can see our performance there. You've got the cumulative for the 3 years in the total column if I work left to right, and then the blue and red numbers are the numbers for last year. You can see there that what our net operating costs were, and therefore what our duties were. So the negative number of 26.789 is our 26.8 million deficit that we achieved. Thank you very much. If you like pictures rather than numbers, this tells you the income we generated, the £1.8 billion, and how we spent it. Thank you. And in terms of a large portion of our spend is on our workforce and the staff who are employed to work at the Health Board. And you can see here what our numbers have looked like in the last couple of years, and also how that splits by profession and staff group. Thank you. In terms of how our accounts are verified and audited to make sure that they are a true and fair reflection of the position as stated, we work through our governance structure in the Health Board through an audit and assurance committee. Audit Wales come in as our external auditors on behalf of Welsh Government to review our accounts and our statements to make sure that they are genuine and legitimate through a series of testing. They rely on internal audit and counter fraud, and they rely on us as the team for the Health Board, providing representation to them of what we've done to safeguard the funds and spend it in the most appropriate way. Those accounts, when they've been through all of those processes in the audit committee, are presented to board, which they were in July, and they are adopted by board and authorised before they're sent to the Auditor General for Wales, where they're laid before the Senedd as part of the overall accounts for Welsh Government. The upshot of that is we had an unqualified opinion on our accounts, which meant that the auditors were satisfied that they were prepared in alignment with the accounting policies and standards they would expect to see. Thank you. In terms of where we are, obviously starting with a 26.9 million deficit at the start of the year, we had some, in terms of our funding going forward, we were looking into the 23-24 revenue position of a deficit of 88.4 million. There are two reasons for that. Mainly, one is that our COVID response costs and some of the additional costs that we have incurred during the response to the pandemic are still a legacy in our system, and they are still prevailing, although the funding to address those is no longer available, because that's needed to deal with the cost pressures, including pay award, energy price increases. So we have had many more costs appear and be delivered than we've had funding to cover. So therefore that has driven our deficit to the 88.4 million. In order to hit that number, we need to provide 4% of savings. So that's the £32 million you can see there. And we've done that through setting stretching ambitions and trying to make sure that all of our costs and all of our resources are deployed to the most needed activities that we need to generate in the year. And what we've done as a board is we've started to review, and we will continue to review during the next coming months and years, how we can get to a sustainable financial platform. And the quality strategy and statement of intent that you've seen earlier is going to be a big part of how we drive the right services delivered at the right times in the right places, in order to make sure that we are delivering on behalf of our population and get back to managing within the resources that are available to us. Thank you. Happy to receive any questions on that.
I think, Catherine, as a board, we've discussed these figures frequently over the last 12 months or so. So we'll move the questions onto the next agenda item, if you don't mind, and those are from the public. So if you want to carry on with the presentation, or have you completed?
There's a couple of slides there just to refresh colleagues of what we've done in our capital programme. So I'll just go through those very quickly, if that's okay, Chair. In 22-23 we had the £55 million, and there you can see what we spent that on. In terms of maintaining state, the robotics we've already talked about, as well as some infrastructure in our community to make sure that we can deliver on our community ambition. I'll move on to the second, and that is this year's capital programme, which is just shy of 30 million, and quite a lot of that is being spent on our infrastructure, as well as some health and wellbeing centres out in the community, and also some digital programmes. Thank you. Chair, I'm happy to stop there and take any questions as part of the overall questions.
Okay, thank you very much, Catherine. And again, thank you for condensing such a massive amount of information into a really concise version of what has happened in the last 12-month period in particular. And I'm pleased that we're looking forward with a positive eye, but understanding the realism of the situation we're confronted with. And I understand also that finance is everyone's responsibility within the organisation. It's not just you and your team, Catherine, or just the board. It's everybody can play a part here. And what I've been pleased about is that I'm seeing that most people certainly are. So thank you for that, Catherine. Okay, we're going to move on now to questions from the public, item 4 on the agenda. What I'm going to do with this today, I'm going to ask Matt Phillips, our Director of Corporate Governance, to read out the questions that we've received. And once he's done that, I'll then invite a member of the board to provide a response. So Matt, if you want to take the first question, please, and read it out.
Thanks, Chair. The first question is, how will you ensure that the failings of leadership and management that characterised the Lucy Letby and other such cases do not occur within Cardiff and Vale University Health Board?
Thank you, Matt. What an appropriate question. Suzanne, I'm going to look to you as Chief Executive Officer to field this one, if you don't mind.
Very, very happy to take this question, Chair. I guess there's a number of things that I might respond with, but I think the key to it sits in the description and the presentation I gave around the quality statement of intent. Fundamentally, what needs to happen is that there needs to be a coherent, robust and utterly reliable approach to quality management in the organisation. And I think we have got some really strong areas of that and areas where we need to improve more. So where we're strong at the moment, I think, is in the degree of transparency that colleagues bring to the conversations around quality. There's a really good approach to securing assurance and reporting on that. And I think there is an absolute tangible intent in the organisation to deliver the very best quality of care for our patients. But I think where we are and have opportunity to improve will be in some of the areas that I pointed at. So ensuring, for example, that we have mechanisms to collect really good data and share that data and achieve insight from it. So, for example, in relation to the Letby case, had the board in that institution been receiving regular, reliable data in relation to, let's say, neonatal mortality, and they were able to benchmark that data, that may well have started to give indication of a concern that they would need to look at more deeply and explore. Now, in the circumstances where you've got an organisation that's got cultural challenges and all the rest of it, that isn't going to work on its own, which is why you need a triangulated response and approach. But that would have been an important part, and as board colleagues will be able to qualify, we have been sharing mortality data with yourselves, including neonatal mortality, for some time now. There's always more work to do to make that data more accessible and easy to interpret, and that's the journey we're on. I think another place that we need to do more improvement on is actually our approach in the organisation to improvement. How do we identify areas of good practice that need spreading and scaling? How do we support those colleagues? How do we bring pace and energy to that amidst all of the priorities we've got? So that's a work to do. And then there's the sort of cultural piece, which really I think has come through very strongly in the Letby case. The talk about psychological safety, the ability to speak up safely, the sense that if you do speak up, you're listened to and heard by the leaders in the organisation. I mean, that is absolutely essential. And I think it speaks to our organisational values, the behaviours, and how we interact with each other. And only this morning, Chair, the senior leadership team were discussing an approach to culture in the organisation that would bring to bear a cultural diagnostic tool which would help us make self-assessments of the culture in areas of the organisation, including psychological safety, so that we can support colleagues who need more support in that regard. So this is really a question of the safety culture in our organisation, our ability to collect data and share it and interpret it, and the sense that if you have a concern, you will be heard. And that needs to be done in a coherent, systematic way. And I think the quality statement of intent sets out our collective ambition as a board around that really clearly. And the last thing I would say is I really do wish sincerely I could commit to the board that I can give absolute assurance that a dreadful situation like Lucy Letby would never happen in our organisation. And we will do all our very best to use those systematic approaches to identify those kinds of scenarios should they, occur, which, is incredibly rare. But the rogue practitioner driven by intent and malice is very difficult to identify. So I think the assurance I can give is that we will work hard to implement a really systematic and robust approach. Will that identify the rogue practitioner? No, possibly not, because their intent is to avoid capture. But we will do our very best. I hope that answers the question, Chair.
Thank you, Suzanne. Hopefully it does answer the question quite comprehensively. Unfortunately, we cannot guarantee to avoid such instances. We simply don't know people's intent as individuals sufficiently, do we? But using the measures you mentioned, Suzanne, I'm sure will go some way to preventing anything like Lucy Letby occurring here in Cardiff and Vale. Thank you for that. Matt, we'll move on to the next question if we may, and I think these are a couple of questions which you've put together in one section.
Chair, so yeah, the next one is regarding recruitment and our vacancy control processes. It states we're aware of the NHS financial crisis, but I'm astounded that all the lower bands have been pulled and all you see are band 5 and the higher jobs advertised. We're all working flat out to cover these losses, and at some point we will hit a brick wall. It's the lower bands keeping the NHS running. Without them, there would be no services. We need management, but not as many as there are.
Thank you, Matt. And clearly, this is a question for our Executive Director of People and Culture, Rachel Gidman. So do you want to say hello, Rachel, and then perhaps try and field this question for us?
Great, thanks, Jan, and diolch yn fawr. So before I reassure the author of the question, and just to give some context, and I think probably if you saw one of the slides that Catherine, my colleague, showed around the growth of our workforce. So we have grown in our workforce of over 2,000 people over the last few years. Now that has been initially because of some centralisation of services, but there also has been growth, and we're taking this as an opportunity. So part of the People and Culture Plan is one of the themes is reshaping. So we've decided as a health board that we do need to scrutinise our resource even more so as not only financial, but where we are sort of to reset. So we've implemented scrutinising posts. But just to reassure the author, they sort of allude to lower bands. For me, it's the start of a career sort of individual. So those bands, if they're clinical, we are actually recruiting all of those. We're continuing to recruit, for example, healthcare support workers, allied health technicians, etc. The other posts at senior level, at non-clinical posts, we are stopping. We are asking our clinical boards to really ask the question, are those the right individual posts for our patient care? Because all of us have an impact on patient care, whether we're clinical or non-clinical. So currently what we're doing is an exercise that the clinical boards are reviewing all the posts, all the vacancies, and posing that question to actually reshape. So there may be a bit of a lag. So the individual says that all they're seeing is a band 5, which is sort of a staff nurse appointment. But there will be posts coming out, but it's just a point of time to help us reshape and reset and actually scrutinise to ensure that we're using our resources effectively. So thank you.
Thank you, Rachel. I think that covers the question appropriately, and we can look forward to developing our members of staff to better effect as we look to the future. But we do need to monitor and make sure that we've got the right roles in place to offer that patient service that you referred to, Rachel. Thank you. Matt, next question, please.
Thanks, Chair. It's a question on staff wellbeing. I feel it's a loss to remove the staff haven on the University Hospital Wales site. This space doesn't need to have all the IT and TVs, etc. It wasn't used routinely, but it was always full daily with staff having their lunch. As such, this space was valuable to allow staff to be able to take a break. There are few staff breakout areas, and when you only have a short break, there's often not time to get to Lakeside Staff Haven. Often there's no available seating in Gegin, again making a short lunch break in Tom off Ward very difficult. I'm aware of the financial state, but I'm disappointed by the removal of this facility and the impact on staff. Are there any plans to make this a more permanent, cost-effective feature in the future?
Thank you, Matt, and apologies, Rachel, but this one is heading your way as well. Very much staff orientated. Rachel?
No, that's absolutely fine. Yeah, no, just have to put it out there. You know, for Cardiff and Vale, we take well-being as, you know, so importantly, our staff's well-being. It's all about our people, and if we haven't got our people and their well-being being right at the top of you know, the game, it impacts on care. We know there's a lot of evidence. You know, we need happy staff. So I think the author of this question is alluding to our temporary staff haven, which is our Jubilee Gardens in UHW. Unfortunately, this was a temporary staff haven. We have got that permanent one, as they have alluded to, in Lakeside, but I was very mindful throughout the last few years, through listening to colleagues, around it is a distance for people if they work on wards in the clinical areas or even in different parts of the hospital. So unfortunately that lease has gone, and that is going as in the temporary staff haven. But what we've been able to do over the last couple of years is develop, listen to our staff and develop areas around their staff rooms, in kitchens in the community. And we've actually refurbished 28 areas. Now, we don't want to stop at that, but obviously we have to be realistic in our expectations. So as opportunities arise, we will be looking to develop more staff areas with the staff actually co-producing, listening, but unfortunately that staff haven was always a temporary lease, and that is going, but continue to listen to staff, continue to work with the staff to help and to respond to well-being. But as we get opportunities, the 28 refurbishments that people have shown me around have gone down really well. So unfortunately, yeah, that's going, but we will continue and strive for the well-being of our staff.
Thank you, Rachel. I think it's really important we do adhere to those words of listening to our staff. Really important. And sometimes we can't provide exactly what is needed, but let's keep listening. There might be some great suggestions out there that we can utilise. Thank you, Rachel. Next question, Matt, please.
Yes, Chair, that listening and initiatives leads us straight into this one, which is, as a new member of staff, I question why there is a lack of longer term investment and planning for initiatives that will support patients at home and prevent unnecessary admissions. I have many ideas to help in this regard, and I've been able to demonstrate the benefit and efficacy with minimal investment in the past in other healthcare trusts. These initiatives pay for themselves and improve patient care. Will there be opportunities to discuss these, as I'm being told there's no money to consider my new approaches?
Thank you, Matt. I'm looking here at our Chief Operating Officer, Paul Bostock, as probably the best person to field this question. Paul?
Yes, thank you very much, Chair. And I think I'll probably come on to answer this more fully when I go through my set of slides around delivering the plan, because there is absolutely our intention to move care from secondary care into primary and community care. So we're really, really interested in people's ideas and thoughts about how we might do that. There is money, there's just no new money. So any money that we spend, we have to find from somewhere else. And you know, my slides in a minute will talk a bit about how by moving from secondary care to primary care, we should be able to provide better services for patients, but in a cheaper way, in a more cost-effective way. So I'm really sorry if this member of staff or whoever's written this question feels that they've not been listened to. And there is absolutely opportunity to be listened to, and if they want to drop me an email or contact me, then I'm very happy to facilitate a conversation, but hopefully a bit more detail will come apparent when I talk shortly.
Thank you, Paul, and I would echo that sentiment of offering your ability to link in with this individual, particularly if it's a member of staff. If they want to email you direct, Paul, I'm sure you look at what they've got to say with interest.
Yeah, completely.
Thank you. Next question, please, Matt.
Considering the recent Welsh Government announcement regarding financial savings, what are the Health Board's plans to reduce budget expenditure?
Thank you, Matt. Executive Director of Finance seems to fit the mold here, but Catherine, yeah, you may want support from Paul. I don't know. Let's go to you first of all, please.
I think, as Paul says, he's got quite a bit of this covered in his slide. So if I describe the process, then if there's a absence of answer to the question, again, I'd encourage the individual to either get in touch directly. But in terms of when it became very clear that we were going to be in a financial difficulty and for probably more than one financial year, which was last year, we set about looking at where our opportunities to improve were. We've done that through looking at quality, safety, outcomes, some of the things we'd seek to improve. Also, where is our workforce deployed, which Rachel's talked a little bit about there, and also what products and services do we buy and what do we get for those. So it's a wholesale opportunities review of the whole organisation. And that's identified a number of areas where we feel like we can do better for our patients. We can be more cost effective, and we can drive better outcomes for them by providing the services in slightly different ways, with using our staff and their ideas along with our patients. So we did, and then when we built this year's plan, we built £32 million worth of savings into that plan, and we are reasonably confident that this year we will deliver on those plans, but they are the first year of probably a 3 to 5 year journey where we're going to have to deliver savings in that order in order to fund the investments that we need in order to be able to change and reshape our services in a way that we want them to be for the future and for sustainability of patient care within the resources that are available. So that's our sort of overall approach and process. Paul will come on to some of the how, and I'd be more than happy to fill in any detailed and specific questions that colleagues might have, and they're welcome to email me.
Thank you, Catherine. And Paul, perhaps we'll wait for your presentation to hear your side of that contribution. And again, I would echo both Paul and Catherine's sentiment. Please get in touch if you want to ask further questions or to expand on the questions you've already raised. And if you have any issues finding people, send them to me, please. Okay, next question, please, Matt.
So, Chair, we had a number of questions in regarding our estate. So these two questions effectively are representative of those. So the first one is, what assessments have taken place to review the hospital structure for aerated concrete in light of the recent failures in the education infrastructure? And then secondly, repairs to University Hospital of Wales, leaks and more leaks, maintenance cannot attend quick enough. How can this be rectified?
Thank you, Matt. And I see that the latter part of that question asked to me quite often when I go around the organisation. And I think Suzanne has touched upon the fact that, you know, we don't appear to have any rack problems. But Catherine, part of your role also covers estate. So can I invite you to respond, please?
Yes, of course, Chair. So as Suzanne's already updated, we have recently done an assessment of our risk around aerated concrete, and we are very confident that we have no immediate worries or any infrastructure that we need to close as a result of that. And we will continue to monitor and report on that risk as we work through. As many colleagues will know, that we do have fairly, you know, some parts of our estate are new. Quite a lot of our estate is less new, and some of it dating back to the 70s. And on that basis, it is difficult to monitor and maintain and keep running at the level we would wish it to for our patients and our staff and other users of those buildings. Maintenance has been an issue and continues to be an issue. We've worked with Welsh Government to focus on infrastructure and what are the highest risks for the Health Board and how we deal with that. And more recently, we've adopted a number of tests to make sure that we do have resilience on the site. That work is probably, it would be unfair to say that we're done. I think we're more at in the middle way of that journey rather than the start, and we've still got quite a lot of work to do to understand all of the risks that are present on our sites, particularly our older sites, and I'm thinking particularly about the Heath site and potentially some areas of the Cardiff Royal Infirmary. So we'll continue to do that work, continue to work with colleagues as funding and opportunities allow us to put our services on a firm footprint. But as we've also already said, digital is very important to our future strategy, and we need to balance these things alongside each other. And maintenance will continue to be an area we look at how we resource to make sure we can deliver responsive times, and it's not where it needs to be at this point. So I think I want to be very candid about that.
Thank you, Catherine. And I think certainly myself and fellow board members appreciate you being candid, because this is a question that is persistently asked of independent board members when we visit parts of the organisation. So thank you for that. Matt, the next question, which I believe is the last one for this session.
Yes, Chair, the final question. The Nurse Staffing Levels Wales Act 2016 has been in place for 7 years. How many occasions over the last year have the number of nurses deployed varied from the planned roster within the Health Board?
Thank you, Matt. Our Executive Director of Nursing is probably the most appropriate person to field this one. Jason Roberts, please.
Diolch yn fawr, and thank you very much, Chair, for allowing me the opportunity to answer this question. And before I do, I just want to remind everybody that the All Wales Nurse Staffing Levels Wales Act only requires the health boards to calculate, monitor and report nurse staffing levels on 25B wards. And just to remind everybody, those 25B wards include acute medical wards, acute surgical wards and our paediatric wards. However, in Cardiff and Vale, we take nurse staffing very seriously. We always have since the inception of the Act, and we report all clinical areas where we look after patients twice yearly to board in our Staffing Act paper that I present to board. I'm going to break the past year up into two parts, and I'll explain why as I go through. So the first part of this year, and I'm looking at August 2022 to March 2023, our systems showed that we complied with the Nurse Staffing Act on 65% of the shifts that we worked, which of course allowed 35% of the shifts that we didn't. I decided to to split it up into 2 years for an important reason. And for the first part of the year, we were using something called the healthcare monitoring system, which was a manual system which required individuals to manually feed information in. And we've always erred on the side of caution when across Wales, with my colleagues across Wales, we've always erred on the side of caution with those results because of the requirement for manual feed into that system. The latter part of this 12 months, which is March 2023 to August 2023, our system shows that we comply with the Nurse Staffing Act on 78% of occasions, which still meant that almost 22% didn't. That's a great progress within 6 months. And we now use the Safe Care Monitoring System, which is a system that's been adopted across Wales and used in all organisations, which is a system which is reliant on automatic feed. So it receives an automatic feed from our payroll system, and of course the results that we get from these are far more valid, more reliable, and far more robust. However, I just goes to mention that the Nurse Staffing Act does require us to stick to arbitrary figures. So we designate an arbitrary number of registered nurses. We arbitrarily designate a number of healthcare support workers, and we all know, the clinicians amongst us know, that we can have a fully staffed ward and it can still be unsafe, and we can have an unstaffed ward and it can be safe. And our current workforce pressures means that the challenges of ongoing nurse recruitments and the ability to fill all our posts is going to continue into the future. So I believe, and I obviously speak to my board members regularly and my nursing colleagues, that it's more important that we have a system that is sensitive to the variation, the acuity and the dependency of nuances that the patients possess. And that's why we currently use Safe Care Monitoring System. We use it twice a day, every day, 365 days a year, to monitor the acuity to dependency in a sensitive system, in which will enable us to move the numbers of nurses around as best we can to make sure that patients are safe in whichever clinical area they'll be looked after. I'm happy to take any questions or further questions, but I know we haven't got time. So if anybody, the chair, requires any further information on safe care, I'm happy to meet outside or get my team to meet with them to describe what that system looks like.
Thank you, Jason. A, for answering the question. B, for being so frank and candid, which this board really appreciates. We want nothing but honesty. And C, thank you for the offer of further support to anyone who wants to discuss the Staff Nursing Act with you in more detail. And please do get in touch with Jason if you wish to understand a bit more. He's very welcoming and will be very supportive to you, I'm sure, as will all the execs. Okay, that covers the questions that were sent in to us ahead of the meeting by members of the public today. So we now have to bear in mind that as a board, we've considered the annual report, capably presented by Suzanne. The financial accounts we've also considered, also capably presented by Catherine, and we've dealt with questions from the public on those areas in advance of this meeting. So we now need to move to item 5 on the agenda, which is the adoption of the annual report and accounts. And I would ask colleagues if you are content to do so, to adopt the annual report and the accounts for 22-23. Yes? Thank you very much. Thank you. Okay, we're moving on to item 6 on the agenda, which is probably going to help us understand how we tackle the challenges that have been highlighted so far, and the amazing work that's been undertaken and how we sort of build on that platform. So Paul Bostock, our Chief Operating Officer, is going to talk to us about delivering the plan. Paul.
Yes, thank you very much. So I've just got a few slides, and then really it's just to give a flavour, some examples of how we're going to tackle this, because we could spend hours talking through our plans with everybody. I think that we've heard a lot about the context stories, so Catherine's already kind of talked through where we're at, but over the next 5 years, we need to be looking to save at least £32 million a year to be able to deliver a financial model. And that's just based on what we know today. Things will undoubtedly change, but that's the size of the challenge. And what we really want to do is have a different approach to tackling this that's going to be sustainable. So traditionally, and I've worked at the NHS for a number of years, and traditionally each directorate, department, clinical board will be given a target, 4%, 3%, and everybody's then set a savings target. And you don't get very much collaboration, and you end up potentially doing the wrong thing. And what we want to do is not look to cut services. We want to be more efficient, more productive, and be able to treat more patients but that need to be treated, and treat fewer patients if we can prevent them from becoming unwell in the first place. So prevention is also quite a key part of how we deliver this plan going forward. We touched upon this already, but we are quite a secondary care focused organisation, and yet primary care and community care actually have the greatest number of contacts, a number of public interactions. So we've got to continue and in fact accelerate our ambition to move secondary care services, or services that have been traditionally provided in secondary care, into the community, and to stop people having to becoming unwell and needing secondary care services. So as Anne's already touched upon, we have got a real relentless, I would say, relentless focus on improving quality. We know that if we can improve quality, if we can improve patient experience and patient outcomes, that also improves staff morale, staff satisfaction, happy staff, as Rachel said. That will deliver cheaper healthcare. So we know this, and so we must continue on our focus. And so productivity, efficiency, and working across the health board as a system, and working further with our system partners, is how we're going to do this. And we've organised ourselves a bit around the Planned Care Improvement Programme, and I'll give some examples of that, and 6 Goals Programme for unscheduled care. These are the way in which we're going to organise ourselves to deliver this vast scale of change. And I'm not going to sit here and say it's going to be easy. £32 million savings is more than the organisation's done traditionally, so it's going to require a real organisational commitment and focus to do this. And I think we've already demonstrated in the conversation so far that commitment and desire is there. And of course, underpinning all of this is the workforce planning and the types of roles that we're going to need to develop to deliver these new models of care. Next slide, please. So Rachel's touched upon some of this in the response that she gave. So we know that we've employed an extra 2,000 people over since sort of the pandemic, and all of these people have been employed for a reason. There's no question of that. We've now got an MTC that we didn't have before. We've got vascular centralisation that we didn't have before, and COVID also required us to create additional roles. But the pandemic is now largely behind us, so we've got some COVID in the hospitals at the moment, and we're having to kind of try to deal with that more as a business as usual. So we've now got to think about, well, what do we need for the next 5 years? We know what we've had for the last 3 years or last 5 years, but what is the workforce that's going to be required to deliver the new models of care? So this year we're starting to have those conversations, start to think about what the workforce would look like. Right sizing as well, where we can. We spend lots of money on locums, on agency staff, on temporary staff. We'd really want to invest that money better into right sizing departments so they're fit for purpose and able to deliver the services. So that's kind of where we are for this year, and then next year and beyond we start to implement some of these changes and start to embed some of these new models of care. And the outcome that we then look for is that we have a sustainable workforce. Cardiff and Vale is the place that people want to come and work. Why wouldn't you want to come and work here? That's the kind of mantra that we're trying to develop. And it will be a cheaper way of providing care. So that's the workforce is, and our staff absolutely crucial into doing this. Next slide, please. So just to give you some examples of what being more productive and efficient might look like in terms of a planned care. So we know that we've got more people waiting for treatment now than ever. The NHS in the UK has got more people waiting for some intervention than it's ever had, and so we owe it to those patients to reduce their waiting times and to start that treatment in a timely way. But we also know that we're not very efficient. So in outpatients, for example, we have a very high DNA, did not attend, did not come to, patients not attending their appointments. Now, often it's because they waited so long that they've forgotten when their appointment was. We've cancelled and rebooked their appointment so many times, they've got confused and don't know when it is, or they've waited so long and it's got better and they don't need the appointment. If we could reduce our DNA rates, the number of appointments that sit empty in our clinics to 5%, that's 4,500 extra appointments a month that we could then give to patients who are waiting to be seen in our outpatient clinics. So that's the size of that's the opportunity that we can releasing extra appointments at no cost, because we're already paying the staff to see these patients, and we've got gaps in some of our clinics. We also want to, when we deliver this plan, we want to make the patients to feel more empowered, and really we want to move to a position where the default for many types of pathways and patients is that they are in charge of their follow-up. So rather than be given you'll come back in every 6 months whether you need it or not, we work with patients to say, you come back when you feel you need to come back. So either through a patient initiated follow-up, a PIFU, or SOS, see on symptoms. So again, by working with patients and being really clear about which type of follow-ups we'd expect, we could create more capacity for new patients. And healthcare pathways in all specialties is really where we're trying to get to. So from in primary care, when GPs or specialists see patients, how do we manage that pathway all the way through, and where might the treatment happen or the intervention need to happen, and secondary care, then just receiving the referrals that only secondary care can do. And that's the whole bit that we're working to, making the acute side, secondary care, deliver what only secondary care can and need to do. Same for primary care and community care. So again, there's just some examples around outpatients. Next slide, please. In terms of theatres, we have a large number of theatres lists. I want to say we have something like 45-50 operating theatres across our organisational footprint, and we're quite efficient in theatres, but if we could get to 95% of theatres running all of the time, then we would free up 15 sessions a week. That's 1.5 theatres a week that would be available for patients to be treated. If we could reduce the turnaround time between patients to 10 minutes, and again, we are quite good at this, so the opportunity is less. We could probably do an extra half a patient a session, okay? But over 40 lists, that's actually quite a few extra patients a week. Again, and all of this is a no or very low cost, because the staff costs are already there. It would be just the cost of the consumables, etc. And then we need to go through the list from Welsh Government. So actually, there are a reasonable number of patients who are on our waiting list for operations that don't actually meet the criteria as set out by Welsh Government. So these are conversations that we need to have going forward with patients, with our GP colleagues, with our secondary care consultants, that we're only actually putting on the waiting list the patients that need to be put on the waiting list. Next slide, please. So this is the big one for us, and this is our real organisational focus, is around our length of stay. So our length of stay for the Cardiff and Vale is not particularly stellar. There's a lot of work to do. If we could get ourselves to the top 25%, and CHKS is a kind of, it's an organisation that benchmarks organisations across the UK, so it's a well-respected benchmarking organisation. If we could get to the top 25% for all specialties, and that would be a bit of a push, but that would free up potentially 300 beds. That shows you the size of our length of stay opportunity. And we talk a lot about beds in secondary care as a currency, but a bed, inpatient bed, costs anywhere between circa about £400 a day to staff and manage and service and look after. It's not just the doctors and nurses, it's all of the support services that go around. So we spend an awful lot of our money as a health board on beds, inpatient beds. SAFER is an acronym, but essentially SAFER is how we manage inpatients. So, you know, how do we do ward rounds? How do we do board rounds? How do we keep patients involved in their care? How do we keep families involved in their care? How do we set the expectations about what the hospital's here to do, what the hospital's not here to do, what the community services are here to do, etc. And if we can reduce particularly the long length of stay, so the terminology is stranded and super stranded. So patients who have been in our beds for, it's actually 7 days and 21 days. Those are the patients who we really need to support and focus on, because as everybody knows, the longer you're in a hospital, it's not a particularly safe environment to be in. So once you've had your treatment, we need to provide that treatment in a timely way, and then patients need to be discharged home or onto the next level of care, because it's, you know, it's not, you can decondition, there's a risk of developing a health acquired infection, etc. So getting our length of stay sorted out and reducing the number of beds will save a phenomenal amount of money, which then we can then do one of two things for. And if we move on to the next slide. Thank you. So we are really, really committed to moving secondary care into primary care. And we're currently working up quite an ambitious programme of a Safer at Home programme, where we keep patients in their own homes, or they go into community settings, or they get some kind of intervention that's not required by secondary care. And with virtual wards, and we've got any one time, we've got 50 patients who are being cared for by secondary care clinicians, but outside of that acute hospital. If between Safer at Home and a virtual ward, we can get the equivalent of 200 beds, then the money that we've saved by reducing our length of stay for 300 beds, we've got money to invest in primary care and community care, and we've got money to save. So this is why it's so attractive. You do the right thing for patients and we can actually save money. And similar with urgent treatment and primary care centres, stopping people coming to A&E, providing that treatment in a different place is better for patients, and it's cheaper to provide. And we're delivering this through our 6 Goals programme. So 6 Goals is a national programme, and we've embraced it fully at Cardiff and Vale, and that's how we're starting to deliver some of these changes. Just got a couple more slides, please. So next slide, please. So community diagnostics is another example. You know, not bringing everybody up to an acute hospital for an ultrasound or an MRI scan or a CT scan, and we've been successful with Welsh Government funding in receiving some funding for community diagnostic hubs. They should be in place, or it should be, the one that we're looking to develop should be in place by Q4 of next year. That will improve access times for patients and bring the waiting times down. So we bring waiting times down, we diagnose patients more quickly, they start their treatment or intervention more quickly, then that's a much better outcome for patients and will be cheaper in the long run. And we touched a bit upon the healthcare pathways already. Final slide, please. So I haven't tried to put lots of numbers into this. I didn't want to make this particularly a financial presentation, but there's so much opportunity for us to provide care in a different way that will undoubtedly save money for us and give us the opportunity to decide where we invest our £1.8 billion worth of public money and where not to. So we absolutely recognise, as the operational team, there is no more money. We have to work with what we've got. But actually there is quite a lot of opportunity, albeit it's not going to be easy to provide things in a different way. So yes, that's essentially, Chair, how we are organising ourselves and what our focus is going to be over the next 2 to 3 years.
Thank you, Paul. It's really encouraging, isn't it, to have that forward look extending beyond next week or even this year, taking us into a more sustainable future, we hope. It's not going to be easy. You emphasised that point, Paul, but I've got a lot of confidence in people around this board table and people in this organisation. We're very forward-looking, we're very determined, we're very resolute, So I think there's a real opportunity, as you described it, Paul, for us to make a significant difference to the way we offer care to our patients, make it safer for them, make it closer to where they live, and at the same time reduce some of our costs for us to invest elsewhere to provide even more better services. We've got time for a couple of quick questions for Paul, but I know we're going to look at this very carefully as a board as we go through the rest of this year and beyond. Any quickies? Okay, we'll move on then. Thank you, Paul, ever so much. That was really helpful, really informative. We're going to move now to item 7 on the agenda, which is a video. It's a little look back at some of the things that happened in Cardiff and Vale Health Board over the last year. It's a fantastic feature, in my humble opinion. I hope you like it too. We might have a little time lag before it actually gets up and running, and that's not Nathan's fault, who's running the show for us on this one. It's just one of those quirks of IT. So Nathan, if you want to trigger it, and we'll all sit and wait for it to kick in. Nathan, we've not got any sound.
I'm gonna give you my heart.
Chair, I had sound.
Oh, right, it's me then.
Yeah, that sounds.
Okay, carry on then. Sorry, Nathan.
We're with the primary care team at the Cardiff Uni Freshers Fair, and we're going to put some of the students' health knowledge to the test.
'Cause you light up the path. I don't care, go on and tear me apart. I don't care if you do.
Welcome to this series of Advent readings and reflections which starts today. We hope these will help you journey through Advent towards Christmas and beyond to Epiphany.
I'm excited to share with you briefly the work that I've been involved with the midwifery-led healthy pregnancy clinic.
The largest nursing strike in NHS history is underway.
Nurses across much of the UK launched an unprecedented strike today.
I and we wish you all
a very happy Christmas and a peaceful and healthy New Year.
I wanna die in your arms.
So I decided to become a scientist because I've always loved science. It was my favourite subject in school.
So this job enables me to learn more about the area of science that interests me most.
So Lions Barber Collective has a vision of a world free from suicide and a mission to create non-clinical, non-judgmental safe spaces.
A message for all midwives around the world. Thank you for everything that you're doing.
It's National Day of the Midwife. We're all amazing. We're all wonderful, and I'm really, really privileged to work with them all.
Today is International Nurses Day, and a big thank you to you all for all that you do every day. We want to invest in our nurses and midwives. We want you to be the best that you can be.
By giving a unit of blood, we'll give the likes of me hope to improve and to recover from the conditions.
75th birthday to the NHS.
Happy 75th birthday to the NHS.
Happy 75th birthday to the NHS.
Happy 75th birthday to the NHS.
She was there for me on the end of her phone if I needed her, and she made me feel I could do it.
Thank you, Nathan. Unfortunately, my sound failed to work, but luckily I'd heard it before, and I hope you enjoyed the video as much as I did when I heard it. Really captured a few emotional moments for a lot of us, I think, throughout the year, and emphasised how important our people are to us, and how important our staff and partners are, as well as the population we serve, of course. But thank you, Nathan. I hope you enjoyed that video, everybody. We're going to move on then to item 8 on the agenda, which is the launch of our strategy refresh. As Suzanne alluded to earlier on, our original strategy, Shaping Our Future Wellbeing, struck us as being pretty near the mark as to what we wanted to achieve as an organisation. But what it didn't do, perhaps, is reflect what we want to do, bear in mind what's happened in recent years in particular, and how our services and patient demand has shifted. So a refresh we felt was more appropriate than actually redoing the whole of Shaping Our Future Wellbeing. Our Executive Director of Strategy and Planning is going to lead us on this one. Her and the team have worked really hard to produce the strategy refresh for us in quite a short timescale, with a very significant engagement process as well. So Abby, I'm going to hand over to you, please.
Chair, thank you very much indeed. And it's a real privilege to bring this in front of the public today at our AGM. Next slide, please, Nathan, or whoever's driving. I just wanted to start with echoing the thanks that Suzanne made at the beginning and the comments that you've just made, Jan, in terms of the contributions of people. A strategy is only as good as the contributions that we've had from people who took the time to attend the many events that we held, both online, in public, and the lots of surveys and online responses we had to feed into the process. So we really listened to what people told us. Some of the messages we heard were difficult to hear because we were talking to lots of people and they reflected the kind of experience over the last couple of years. And we've hoped that we've captured kind of the feedback appropriately in the strategy going forward. And I have to say that both the planning team and in particular Joe's team, the communications team, have done a really great job with support from Jonathan Gray's team and the I9 team to help us make sure that the process was as robust as possible. Next slide, please. So, as Suzanne said at the beginning, our vision has been updated. Most people told us that they liked the essence of our vision as described in the current strategy, or the previous strategy, apologies. But what we missed from it was about the issue to do with the quality of the services we deliver, as well as kind of health. So our vision has two components to it. Working together, we will help improve lives so that by 2035, people are healthier and unfair differences in health outcomes are reduced. We know that we've got a very wide gap in health experience for people in our most deprived and least deprived communities, and we've got to refocus our attentions to working with partners to reduce that gap. The second part of our vision, as I mentioned, is about how we deliver our services and the sorts of services we deliver, and really setting our goal, as Paul has alluded to, being outstanding in what we do, so that The people who work in our service and the people who experience our services, our patients and the partners we work with, get the very best in terms of outcomes and experience, and that we compare ourselves not just with peers within Wales, but within organisations that are the same as us or as close to us in terms of the range of services that we provide to both the local Cardiff and Vale population, but the wider South Wales population that we provide tertiary and specialist services for. Next slide, please. So we have developed 4 strategic objectives in the strategy, which have reflected the things that people told us were important in the organisation, and the things that we need to get behind in terms of delivering against the vision that I have just articulated. Next slide. I'm going to run through each of those very briefly. So the first is putting people first, and it really reflects what Rachel was saying when she responded to some of the questions about, you know, our people are so important to us. We want to be a great place to train, work, live, where we listen to and empower people to live healthy lives. And in terms of what we want to achieve by 2035, that's about ensuring that colleagues would recommend us as a great place to work. We want to be able to attract the very best, retain the very best people. And we want our workforce to reflect the diversity of our communities. We know that we're not doing that yet. And that, as I said before, more people are living healthier lives. And what we set out is some milestones that sit underneath the strategy that will help us see how we're making progress towards the 2035 targets. Next slide, please. So the priorities that we've developed about making sure that people feel valued, developed, supported and engaged. Things like the staff survey that's coming out in the next little while will be a really important marker for us and a good baseline to build on over the next few years. We want to ensure we have a really inclusive culture. The first question that Suzanne responded to had a really important component about the culture. We need a culture where people in our service, providing our services, feel that they're included and empowered and engaged, but also the patients and the communities we work with also feel that we have an inclusive community and that they feel they can speak up and they're empowered and enabled to participate and help us shape our services going forward. And we also know that we want to work with our local communities to understand better what will help people to live healthier lives. How can we reduce the risk of ill health, knowing that that risk is different for different parts of the communities that we serve. Next slide, please. The second theme is about providing outstanding quality, and as Paul mentioned in his presentation, quality is the heart of everything that we do. And our aspiration, as set out in the strategy, is about providing outstanding service which are equitable, timely and safe, and where we treat everybody with kindness, and individuals are supported to achieve the outcomes that matter to them. So a really important focus about the outcome of the intervention and support and care that we are providing. And the second component of this quality theme is about reducing health inequities, so that we really focus on prevention and that we improve access to the right kind of clinical services and clinical support and outcomes for our citizens. Next slide, please. To achieve that, we've identified a number of priorities that we'll be focusing on. So as I mentioned, the focus on minimising health inequity. So really thinking about healthy behaviours, how we shift more of our resource over time towards preventative services, ensuring swiftly, timely access to services when people need them, and empowering people to come back into our service when they think something's changed. So some of the services that Paul was describing in terms of things like Patient Know Best, and really focusing on the unfair and unjust differences that our populations experience, and that we've already talked about as part of our health equalities work that we are progressing. The second priority is the outstanding quality of care, first time, every time. We provide a very complex range of services. So I think, as Suzanne reflected in the presentation she gave, from very complex care to the most critically ill patients, example being the kind of major trauma services that we're providing on through our major trauma centre, and some of the things like the transplant services we provide for the populations right across South Wales, to our more routine services around prevention and access to general healthcare services. So really focused on how we address the physical and mental health needs of our populations, and really focus on, as I said before, what matters most to those individuals, to their families and to their carers. And our approach to this will be putting continuous quality improvement at the heart of everything we do, so that we are making this as part of our decision making about how we make best use of the resources that we have available to us. While resources feel constrained, as Catherine and Paul alluded to, we do spend a large amount of public funding, 1.8 billion, sorry, this last financial year, and we need to make sure that's giving us the very best in terms of quality outcomes for our population. Next slide, please, Nathan. So then the third of our strategic objective themes is around delivering in the right places. Again, a theme that you've heard through the presentations and discussion this afternoon is around the quality of our state, and the need to continue on our digital maturity journey so that we have the right kind of digital infrastructure in place to enable modern, high quality healthcare service provision for our patients. So by 2035, we are committing to using real-time integrated data to inform decision making and to enable multidisciplinary team working, giving people access and ownership to the right kind of data to enable them to manage their health and well-being and to inform decision making, as I've said. We'll also be well on our journey to provide care in the right place in facilities that are fit for purpose and flexible and promote recovery. And again, question that we've had were two of the questions related to the state of our estates. And Suzanne identified that as one of the most pressing priorities that we have got. That will take some time. We won't have everything achieved by 2035 because we know that the lead-in time for some of the big schemes in terms of capital developments will take time to come to fruition, but we will certainly be very much further down our journey in terms of securing the right kind of facilities by 2035. Next slide, please, Nathan. So as I've mentioned, we've got a number of priorities to achieve the objective. I've touched upon digital maturity. We are not where we need to be or want to be as an organisation, so we've identified that as a really important and key priority for us to get behind. Creating facilities in the community. We've got a pipeline of health and care facilities that we want to develop with our local communities, with our partners in the local authorities and third sector. We've got the first of those open in Malva, and we want to continue to develop those in each of our localities and 9 cluster areas. Clearly, Cardiff University is a really key partner for us, particularly in relation to UHW. They are about a third, they occupy about a third of the space at UHW, and they're a really key partner in terms of both providing our acute care, our research, our teaching, our clinical innovation, and we want to make sure that together we develop our plans for the hospital infrastructure so that we've got the right facilities to provide the very acute care that we provide. And more shared infrastructure. The model that we've got for our health and wellbeing hubs and our wellbeing hubs is very much one we're developing with our local authority and third sector partners. And we're also working with private sector providers where that's appropriate. So I was very glad to see in the video the opening of one of our new GP surgeries in Whitchurch Road, which is a development that we've taken forward with private sector partners. Next slide, please, Nathan. So the fourth of our priorities is about making sure we take our responsibility for future generations very seriously. This is absolutely about what is core to the Wellbeing of Future Generations legislation Welsh Government brought forward a number of years ago now. And although we give us a lot of focus to this, we need to kind of redouble our efforts to both make sure we're reducing our carbon footprint. Health and care is a big generator of carbon emissions, and we need to do more to ensure that we deliver the targets that have been set for us and go further than those targets in terms of the way that we deliver our services into the future. Next slide, please. So our priorities are fourfold. The first is about research, teaching and innovation, and again, particularly with Cardiff University, but our other university and higher education partners. So really making sure that we do remain at the forefront of of changes in clinical practice, enabling to bring our research to come through to improve the way that we deliver our services and to tackle the very challenging and pressing issues that we face as we have an ageing population and challenges relating to coming out of the pandemic, the climate emergency, and a challenging financial context that we're going to be operating in the next decade and beyond. So really thinking about our role as a tertiary provider in terms of cutting edge and novel treatments, making sure that we remain at the forefront of those technologies, some of which will give us solutions to the future. And again, we heard today already about things like the robotic surgery that is taking place and meaning that we've got shorter theatre sessions. I was talking to a colleague the other day about the imaging, what he can see when he's undertaking surgery through a robotic approach, much better definition, and that's got to be much better in terms of experience and outcome from the surgery that we undertake through that mechanism. To maximise our contribution to the health foundation economy, we are a massive contributor to the economy in Wales. We account in health for about 50% of the Welsh Government's budget, and we play a significant contribution to the economy in Wales, and we can go further with that. So working together with shared services and other colleagues to make sure that every pound that we are spending as much of that as possible in Wales with local business in Wales and local suppliers in Wales, and that where we have to look further afield, that we are making sure that we're challenging our providers to make sure they're doing the very best they can in terms of the Welsh pound contributing to our populations. You know, most of our staff work in our patch. The money that they earn through the salaries also goes round in the kind of a circle and is invested in our local economies too. So that's really important part work too. And Public Health Wales has produced with the NHS Confederation some really useful information to help illustrate that for our staff and to help us with our work. And the fourth target is around, or priorities around, our carbon emissions. I've touched upon this already. We all like to sit in our cars and many of us like to listen to our own radio channels as we come into work. We've got to change our habit. It's going to be difficult. We've heard the bit of the backlash around the 20-mile-an-hour speed limit that's coming into some of our urban environments. We've really got to back and get behind some of those initiatives because those are things that will help us reduce our carbon emissions as we go forward. The buildings are a contribution to that, and how we procure and where we procure our services make a big contribution, and the way that we deliver our services makes a big contribution. So we do need to recognise all of those components, and we've got a very good carbon reduction plan in place and being actively pursued this year. Next slide, please, Nathan. I wanted to draw attention to our website, and I can take no credit for it whatsoever. But as part of this launch, I would really encourage you to have a look at our Shaping Our Future Wellbeing page on the website. The team have worked really hard to pull it together. It's a really good place that our local communities, the partners that we work with, our wider communities, our staff and board and colleagues can see more of the detail around the areas included within our strategy. We'll use it as a live place that we bring updates, because clearly one of the things that we've talked about a lot and you'll see featured in the strategy document are milestones that we're going to hold ourselves to account for in terms of making sure that we remain on track to deliver our strategy. And as you'll see coming through this year as we develop our integrated medium-term plan, we're already thinking about how next year's plan clearly aligns to the four priority areas that we've identified, strategic objectives within our strategy, so that we can be clear that everything that we're doing is all helping to contribute to those four areas that we have identified as the important things that are going to make a difference in terms of delivering against our vision. Chair, I'm happy to stop there. If there are any particular questions, I know this is coming to the board for the final sign-off at the last board meeting, but because at the last board meeting there were a couple of very minor tweaks, but I'm just so pleased and proud to bring this to the AGM for formal launch. There'll be lots of roadshows out in the organisation over the next little while, so there'll be lots of chance to have conversations with people, both through clinical boards and through a series of roadshows that the planning and comms team are helping shape and help oversee and help deliver. Thank you, Chair.
Thank you, Abby. Such enthusiasm, I have to say. Well done. And you're right. I mean, the board has approved the actual strategy. We're just going to ratify that in the public at our next meeting at the end of this month, next week. But this is the formal launch today. And it's really encouraging to me as chair to see our strategy brought bang up to date and taking this organisation forward for the next 10-year period and beyond. So well done, Abby. I think we'll avoid questions today, if you don't mind, Abby. We'll save those for the ratification process next week at board. But thank you again to you and your team for the great work you've done in developing this strategy and making sure that we've consulted and engaged very fully across Cardiff and the Vale. So really appreciate it. Well done. Okay, we're going to move on now to really the end of this annual general meeting. So it brings it to a close for this year. I'd like to thank, if you don't mind, a few repeat thank yous, but I really would like to thank our wonderful staff yet again for their massive contribution throughout the year. Thank you everyone so much for that, and I really mean that from the bottom of my heart, and I know board colleagues feel exactly the same. Without you, we don't have a service, so really well done and thank you. Perhaps I could also thank our partners and our stakeholders who've worked so closely with us over the last year or so to ensure that our healthcare system has operated as effectively as it possibly could have at all times, and that's not been easy sometimes, so thank you very much to our partners. Not least, perhaps I would like to thank the people of Cardiff and the Vale of Glamorgan for their amazing support and their understanding during such a challenging time for the NHS in Wales, and particularly for us here in Cardiff and the Vale. So thank you everybody for being so supportive. And also my thanks to everyone who's attended today. I hope you found the meeting helpful and informative. A lot of information to digest, I know, but hopefully you found it helpful. And just to let you know, the year in review video and the annual report will be available on the Health Board's website in due course, and a recording of this session will also be available to you. So thank you all very much again. I look forward to seeing you all very much again next year. Diolch yn fawr, hwyl fawr.